Hi, and welcome everybody to our first community meeting in North County in Bridgeport. We're going to have a second one tomorrow night in Antelope Valley. We're definitely experiencing a little bit of growing pains with this meeting and trying to get everybody who we intended to have participate on the panel get on to this meeting. But what the purpose of this is to address community specific concerns and also to cover the COVID-19 crisis in general. You know, we all have a lot of questions about all of this. A lot of questions we ask ourselves, a lot of personal accountability. People want to know how they can help. How long can they do this? How long can they keep going in isolation and stay at home? Was it all necessary? So we ask a lot of these questions, a lot of introspective sort of looking in and then looking out for help. And the whole purpose of the county forming its IOC, its EOC, its unified command was to try to provide that safety net that Mono County can provide for the health and safety of all of our citizens, our visitors, the travelers coming through. So we attempted to put together a group of people that can answer questions, address concerns, and I'm going to try to address a couple of them in my brief comments, and then we have a lot of subject matter experts and people that are involved in the Unified Command. And all of this organizational strategy to get a meeting like this in place has to be approved through our public information officer, through the EOC. And so I want to thank all of them for the hard work that they put into it, because countless hours have really gone into this. A lot of you are going to have questions about the fishing season, the opening of fishing. I was hoping to have more answers or more clarification at this time, but the Fish and Game Commission meeting, as many of you know, didn't go off so well last week. So they're having it again tomorrow morning at 10 a.m. So I would tune into that. You can provide public comment, listen to the Fish and Game Commission. Most of you are aware that Inyo, Mono, and Alpine County, as well as Sierra County, have asked that fishing season be paused until the governor's stay-at-home order is lifted at a minimum. So we're hoping that can, the reopening of fishing season can occur with the governor's stay-at-home order being lifted, and the provisions for only locals fishing. If that was one of your questions, can a local fish in their local area if fishing season is closed? The answer at this point is no, unless the Fish and Game Commission comes up with some other strategy, which isn't known to anybody at this point. That's an answer to that question. The May 31st stay-at-home order in Mono County. Lots of people have asked, why did we pick May 31st? The governor's order is indefinite. Why aren't we aligned with that? So there are some reasons that at the time it was that date was set, having to do with transient rentals and the ability to temper people taking reservations in transient rental, Airbnbs or whatever, prior to being able to reopen. So, and that's being looked at and discussed in the EOC as well. There's a lot in the business community, questions, concerns about support, how to get the government loan support, SBA, PPP. We have resources that are actively participating. Jeff Simpson in our economic development department probably talks to about 30 to 40 businesses a day. There's lots of resources online, but the bottom line is you need to establish a relationship, if you don't already have one, with a local bank or your bank that you bank with, whether it be B of A, Wells Fargo, Eastern Sierra, Community Bank. Develop that relationship. The county will help guide you to resources as well. There'll be other community resources, topics covered, food distribution, mental health issues, public health. I'm going to let this kind of transition to the EOC formatted community meeting now, and we're going to have a bunch of panelists that are going to speak, and I'm going to let you know who they are supposed to be, and if they haven't been able to join, well, we're going to make this work. So we have Brian Wheeler from Mono County Public Health. He's the moderator. Frank Freefault, the EOC director. Chris McCrasick, he is the EMS chief. Bob Lawton is the Mono County acting CAO. Cassandra Montez, Latino Outreach. And welcome, Cassandra. I know she's new to the county. She's provided a huge amount of resource for the Latino community. Brianna Brown, Bridgeport Chamber of Commerce and Bridgeport RPAC. She also has a role in the IMACA food distribution. And then the intent of these meetings from the very beginning was to have a local connection. So our fire chief, Bill Pemberton, is also a panelist, and our sheriff, Ingrid Braun. So with that, I think I exceeded my 5 minutes, and I'm going to remind everybody, this is a meeting that needs to be about constructive dialogue. Type in your questions. There are moderators to funnel them. We will do our best to answer all of them. And if we can't get them answered today, we will we'll get individually back to you. I'll get a list of those. This meeting, I believe, as all the other community meetings, is being recorded. It will then be available on YouTube and on our COVID-19 page. And I'll turn it over to Brian.
Thank you, Supervisor Peters, and thank you for having us here tonight. Before I begin with the public health update, I would like to have Cassandra Montez address the Spanish-speaking population, please.
Hi, good evening, Brian. Thank you, Supervisor Peters. So tonight, my name is Cassandra Montez. I am leading the Latino Outreach Committee to inform the Spanish-speaking community on the latest information on COVID-19 in our County of Mono. Hola a todos, buenas tardes. Mi nombre es Cassandra Montes, dirijo el Comité de Extensión Latina para informar a la comunidad de que habla español sobre la información reciente sobre el COVID-19. Our Latino Committee of Mono County hosts a weekly Spanish virtual community meeting on Thursday nights at 6:30 p.m. via Zoom. Nuestro Comité Latino del Condado Mono organiza una reunión semanal virtual en español los jueves por la noche a las 6:30. This meeting is to provide the Spanish-speaking community the resources that can help during this pandemic. Esta reunión es para proporcionar a la comunidad hispana del condado con recursos que pueden ayudar durante esta pandemia. Such information on local food banks, housing, social services, and how to cope during these times. Por ejemplo, información sobre bancos de alimentos locales, vivienda, y servicios sociales. In this meeting, there is given to the participants who are listening where they can ask questions regarding the county stay-at-home orders, how to take precautions outside of home, and other COVID-19 related questions. Esta reunión se da tiempo a los participantes que están escuchando donde pueden hacer preguntas con respecto a las órdenes de quedarse en casa del condado, cómo tomar precauciones fuera del hogar y otras preguntas relacionadas con COVID-19. For the latest updated information on COVID-19 for the Latino community in Spanish, please visit coronavirus.monocounty.ca.gov. Para obtener la última información actualizada sobre COVID-19 para la comunidad latina en español, por favor visite nuestra página coronavirus.monocounty.ca.gov or visit our Facebook page, Mono County Health, o visítenos en nuestra página de Facebook, Mono County Health. Both of these pages include the date and time on when we will be hosting a Spanish virtual community meeting. Ambas páginas incluyen la fecha y hora en que seremos anfitriones de una reunión de la comunidad virtual en español. Thank you. Gracias.
Thank you so much, Cassandra.
Thank you.
I will now give a brief public health update regarding Corona, and then we will move on to Frank Friebold. So currently, we have 23 cases that have been diagnosed in Mono County. That includes 2 new cases on Sunday, and one of those 2 cases being from the central and north region of the county. We are currently working with the hospital to increase testing capabilities and have loosened guidelines for testing. So we are offering more testing. And we are also following up on all cases in a speedy manner as far as contact tracing to ensure that all people that have been exposed are isolating and quarantining to help prevent further spread. I do also want to briefly talk about the nurse triage line, which you can get to by dialing 211. And if you need to speak to a nurse, you feel you have symptoms, you have questions, you would like information on testing, you can reach out to that number between 8 and 5, 7 days a week, and you will be able to speak to a live nurse. Beyond that, I would like to thank everyone in Mono County for their cooperation with all these mitigation steps we put in place. You know, the social isolation, the lack of businesses being open. It is making a huge difference in the surge that we'll see here in Mono County. And I just wanted to express my sincere thanks to the community. So that's my brief public health update. I would now turn it over to Frank Friebold if he's on the line so he can speak to us. Frank is our unified command leader. Frank, are you on the line?
Yes, I found a cell signal.
Perfect. Thank you, Frank.
All right. Good evening, everyone. Thank you for joining us on this community meeting. We'll try to keep it brief so we can deal more with questions. Essentially, the front end of this obviously came quick upon everybody. Mostly it was about making sure that we had surge capacity for the county. And I believe we've accomplished that. We're in touch with the hospital regularly. They have increased their surge capacity about almost 5-fold over what they had normally. And we've got a good setup for pre and post hospital care and treatment. We're working closely with public health to make sure that we're building their capacity to handle this next strategic turn, which is about starting to take some first steps back to getting to normal. It's not going to be quick. If you're following the headlines or the governor's speech today, you know, the eyes are turning that way, but they're all doing it very cautiously, as are we. This is going to be about establishing clinical thresholds to start stepping down from some of the public health orders. But we have to do it in such a way that when the obvious and welcomed economic activity comes back, it's not just a race back to normal. If we do that, we're going to erase all the work we've done this last month. History shows us that. If you look at, there's been some good information come out on the Spanish flu from 1912. I think there's 20 some odd cities listed on the summary, and with a very few exceptions, they all show a couple of different spikes. And so I think we've done a good job here in the county to keep our first wave very manageable, and that's our goal for the next round. So we're putting together those kind of clinical realities. We're matching those up to work in our economic recovery branch, headed up by Alicia Venos. Got a wonderful group of people there working hard. In fact, I would imagine if we have any business owners out there in the community, you should have started seeing some surveys for you to participate in. It helps us better understand the condition of your business now, what your needs look like in the future. The Economic Recovery Group is also a place that I would point anybody in a small business who has urgent needs regarding small business administration support and some of the other programs that are coming to federal and state government. So really, at this point, it's about putting together a plan that we can explain to people and then having the discipline to follow it through in the coming weeks and months.
Thank you, Chief. Before we move on, I just want to cover another topic. I was asked to speak to HIPAA, which is the Health Insurance Portability and Accountability Act of 1976, and also the dividing up of the county into zones such as North and Central County, etc. So HIPAA, or Health Insurance Portability and Accountability Act, is a federal law that provides disclosure of sensitive, or I'm sorry, that prevents disclosure of sensitive patient information without consent or knowledge. This includes information of a personal nature, personal identifiers that could lead to that patient being identified. So basically, this law protects the individual from having their medical information or information out there that could lead to them being identified. It prevents that from moving forward. And I can certainly entertain any questions on that before we move on. Does anyone have questions in regards to HIPAA?
I don't see any right now, Brian.
All right, thank you so much. So for reporting purposes, we have divided the county into 3 broad regions: North and Central, which consists of Bridgeport, Walker, Colville, Antelope Valley, and Topaz, Lee Vining, and June Lake. Then we have South and East County, and that includes Paradise, Sunny Slopes, Tom's Place, Benton, Chalfont, and the Hamel Valley. And the last area is the Mammoth Lakes area, which includes Mammoth Lakes and Crowley Lakes. Does anyone have any questions in regards to the broad regions we've divided the county in for reporting purposes?
I don't see any, Brian. Thank you.
All right, thank you. All right, then I would ask if our CAO Lawton, is available to speak about community resources.
And Bob, before you get started, anybody who wants to ask a question, there are functions. There's a portal called Q&A. If you drag your mouse down to the bottom of the screen, if you're not familiar with Zoom, you can type in your questions. And also in the participants, and somebody correct me if I'm wrong, there's a way to raise your hand if you're a participant. And if somebody has a better way of explaining that, so we make sure that everybody knows how to have access to ask questions, I would appreciate it.
That's correct. Thank you, Supervisor Peters. We do have a few written questions on different topics that we can address as we get to the end of the agenda.
Okay. Thank you, Brian. Thank you, Supervisor. Thank you, Justin. Mono County government, which I am privileged to serve, serves all of our residents from Topaz to Chalfont. We and our neighbors live, however, in communities, and it's inside the communities like Bridgeport that our greatest strength lies. County government assists families in need through the CalFresh and other programs. And in normal times, these programs can't meet all of the needs in every community. Organizations like IMACA, Inyo Mono Advocates for Community Action, help step in for our neighbors. In times of crisis, like now, we step forward both through our Emergency Operations Center, for which Frank is responsible, and compassionate individuals in our communities who take the initiative to reach out to those who could use a little support, could use a hand, and may not have the ability to reach out aggressively beyond their own family. I'd like to salute all who serve and who share, and remind you that there are ample needs in our communities. And if you're looking for an opportunity to help out, you're always welcome. And the county and the Emergency Operations Center look forward to collaborating as much as possible with local groups and local initiatives in our communities. Thank you.
Thank you, CAO Lawton. Our next presenter will be Brianna Brown, who is going to speak about the local economic update.
Sure, thanks. So a couple of things on the chamber side. So hopefully most of the businesses have had contact with Jeff Simpson. I know he's working hard to reach out to all of them and all of you guys. If you have questions, please, please, please reach out to him. He has tons and tons of answers to get some of those resources or as much info as he can provide. I'm working with the Economic Recovery Branch meetings and joining those to try to really see what we can do for our businesses. The chamber is going to be having a meeting to kind of start developing our own local recovery plan. Is how are we going to see ourselves coming out of this as the town of Bridgeport and as businesses, but also working with the other chambers throughout the county. We're kind of getting together to pool our resources to try to come out of this together. Next up, our next few holidays coming up, Memorial Day. We have our Memorial Day ceremony. At this time, we're still going forward with that until we're told that that's not happening. We're still planning on having that. So more info will come out as that gets a little bit closer. The same goes for the 4th of July. We are moving forward with that. We're planning on having that. I know that the governor came out with some statements today that we're still looking into, but it's definitely still going forward as of now. And we will make sure that we share as much information as possible when we're making decisions on those. And then the last is kind of the MACA side. So the biggest thing is if you or your employees or you know somebody that needs assistance in any form, social services is ready to take those calls. There's contact information on the website, on the COVID-19 site. Have them reach out. They can do it to social services. They will get those people's names. They'll provide as many services as they can, whether it be our Seniors Meal on Wheel program, which I know is not being utilized by many currently. So that's a great resource that I know some people aren't taking advantage of. The school is still offering their breakfast and lunch program for school-age children. And those pickups are Friday at 10:30. The Amaka food delivery is still taking place every 2 weeks. The social services programs are still being provided, and they're always looking to help anybody they can. So if your employees are saying they're struggling, have them reach out to social services.
Thank you much. Thank you very much, Brianne. That wraps up our key speakers that are presenting. So Justin, why don't we go ahead and move ahead to some question and answers?
Great.
Justin,
So-
real quick, Chief Pemberton, did you want to say anything? I mean, I know you're here for questions, but if you wanted to comment at all, I wanted to make sure you had that opportunity. Just unmute yourself.
I can do that for him.
Chief,
Yeah,
any comments or anything?
No.
Okay. Thanks, Justin.
Okay, so we're going to do our best to answer and address each of these questions as we can. And I'm going to start with the question that was received first. And so we'll just go sort of in order from there. I will review ahead of time so that we don't duplicate. The first question that we received, I heard that the governor is coordinating with Oregon and Washington on plans for reopening our businesses. Do you know if Nevada will be part of this discussion, since so much of our economy is related to Nevada and their economy? Have you requested that of state government?
Chief Freebold, are you available to answer that question?
I'll do my best. This is based on discussion earlier today with my counterpart in Douglas County, who is heading up their Quad Counties EOC. We were discussing, the governor's positions out west. I spent almost 25 years in Nevada, so I'll try to keep in touch there. Essentially, the Oregon, Washington, and California governor's statement for reopening is just a little bit ahead of the Nevada governors, as I understood it today. They do anticipate something, I think, within the next day or two from the Nevada governor. And I also asked for kind of a comparison of what was going on with public health orders in the Quad Counties area as opposed to Mono County. We're looking to see within Yale County and Douglas County to us about our economic recovery planning, and he was actually interested in seeing what we had there. It sounds like maybe just a couple of weeks ahead of them, but it's probably because we're very heavily tourism based.
Thank you very much, Chief. Next question, please.
Why would Crowley Lake not be part of South County along with Tom's Place and Sunny Slopes? It isn't Mammoth. And there are a few questions related to the regions. And so we're going to go ahead and address all of those at this time. Brian?
Yeah, let me take a shot at that.
Sure.
The original purpose for dividing up Mono County into really 3 operational areas had to do with the way community support services with Kathy Peterson. She's heading that up, doing a great job. When I sat down with Kathy back on, it was about a month ago tomorrow, about, how do we get out and support the social services they're already delivering throughout the county, and especially given the fact that we would see an uptick, and she can speak to that later. It was pretty clear that we had 3 general, areas, and they were essentially generally north and south parts of the county. I had a comment earlier today, can we change it to north and central county? Certainly. But in terms of those 3 areas, they had distinct needs and resources for community support. So that's really how we first got it divided up. And then we followed on and merged fire and EMS resources with the fire chiefs in each of those areas, along with Chief McCrassick and the medic corps that he has throughout the county, so that we could use those resources more efficiently if we had a patient surge in those 3 areas. So there was no real reason other than beyond alignment of community support services and have a more efficient alignment of fire and EMS resources if we had a patient surge.
Thank you, Chief. Justin?
Is there a way that the county community can recommend to Fish and Game to not postpone fishing season? Can we just enforce the stay-at-home and social distancing rules instead?
Ingrid, are you on the line? Do you want to address that?
Yes. All right, there I am, unmuted. Take off the reading glasses. We can't. The problem is not the locals wanting to go fish. It's people traveling to our community that could be bringing with them, knowingly or unknowingly, COVID-19. And that's a hazard to our community and our tiny little hospital, and a stress on our resources that we can't have. Plus, with the restrictions on short-term rentals and no campgrounds, no restaurants, nowhere to eat, nowhere to sleep, nowhere to camp, nowhere to dump your RV, it just won't work. We thought about it. We tried to, is there a locals way to do it? There's just, it's all or nothing. And right now we're asking for nothing, just, and not forever, just for a reasonable amount of time, till these restrictions are lifted and we can accommodate visitors when they come here. But right now, I don't have the staff. Our wardens, we don't have the staff for that. Our public lands don't have the staff. And we don't have any place to put these people when they come. And it's thousands of people that come up here for Fishmas. And I understand how heartbreaking it is, but we just can't, we can't take the stress load. And if people come here and they get sick, they get hurt, it's going to be too much for our hospital if we have a surge in COVID cases. And we really need to focus on flattening the curve and getting through this crisis.
Thank you, Sheriff Braun. Great points. Justin, next question.
Chief Revolt had
Revolt,
something.
did you have a follow-up?
Sure.
Yes, also, Sheriff Braun is on these calls with me. We have twice a week a local state and federal cooperators set of meetings. And one of the other things we're discovering is, for all the same reasons that we're struggling with this, the state and especially the federal resources, most of the seasonal workers there aren't from here. And so we're actually having to work to assist them with bringing on some of their employees whom they also have to put in quarantine. So they're on skeleton crews themselves, and that's just on the emergency response side. The rec support that would be required to support a population of people coming up to fish and camp, etc., is just not there. So there's kind of layers to it. We're all working to get back to normal as fast as we can, but it's pretty widespread. It's going to take us a little while to get going.
Thank you, Chief. Back to you, Justin.
What is the county doing specifically for businesses in North County? We're looking at a very short season on top of being closed for the past 5 months. Is the county able to offer any sort of insight to local businesses on the PPP process? I'm sorry, this just moved. And the SBA loan process. Are they aware of anybody in the county who has received funding on either of those?
Bob, would you be able to address that?
Thanks, Brian. I would like to ask if Alicia has anything to offer on that, if she's been privy to any of the latest information.
She's not on.
I don't believe Alicia's on the, right.
I'm sorry.
That said, I'll just jump in real quick, Bob. I did speak with Alicia last week in anticipation of this meeting. They've been doing some strong work, but one of their first priorities that they're working on now, they're ready, is anybody, any place in the county, but certainly especially North County, contact Alicia Venos. She heads up what we're calling our economic recovery branch. And I specifically worked with her last week to be prepared to take calls this week related to all the items in Justin's question. We know that that's a top set of needs our businesses have here in Mono County.
Thank you, Chief.
Is the county working with state officials to come up with a plan for reopening Mono County? It seems as though state officials are going to be rolling out their plans to reopen soon. What timeline do you believe Mono County will be on, and how does that rollout look?
So I think that's for Chief again. Chief Revolt?
I'll start with it, but I would like to let Bob kind of clean up on that one. And just to make sure, if anybody is unaware, as we're working through what this whole EOC thing is and how we're structured, my job is to make the strategic goals of Bob Lawton, your CAO, Dan Holler, the town manager, and our Mono County public official, Dr. Boo. Those three people set the strategic goals for the EOC and the management of this COVID response. I work for them and try to make those things happen. So we're at this strategic point to make this turn. And the question, and it's understandable, everybody wants to know a date. And we all want to put an X on the calendar. We can go, we're done. It's not the way the virus will behave. It doesn't know that X marks the spot. So what we're defining is a set of conditions. And what we want to do is match those conditions such that we know that the hospital can handle the additional cases. They will come. We know that they're built to surge. We want to make sure that public health, that's Brian, Dr. Boo, and their respective staffs, are ready to handle taking the cases one at a time as they occur and managing those through typical epidemiological methods. They didn't have a chance at that when we got started on this. This virus spread so fast and was already in our communities. Public health didn't have any of the testing tools they needed. We're not seeing anything here that the entire country didn't experience. And so when we step back out of this, we've got to give public health a chance to manage those cases rather than put everybody in the situation that we're at now. So it's really a set of conditions that we're looking for, as opposed to, X marks the spot on the calendar. And it is our goal, I don't want to get it too far out over my boots on this, but it is our goal in the very near future to roll out what those set of conditions and plans would be to start stepping back.
Thank you, Chief. Bob, would you like to add to that?
I would, and I appreciate the Chief's description, not only of how we're looking to proceed, but also of how the Unified Command and Emergency Operations Center is organized. We've got a pretty heavy county presence there in terms of staff and staff support, drawing from our agencies, and we make a pretty large contribution. But Frank is the day-to-day, hour-to-hour guiding force on this, and I appreciate the work that he's doing. The governor did hold a press conference, and he did put out a very pretty PowerPoint series, but there were no real specifics, mainly a series of questions and conditions to be answered, much the same way that Frank has put forward. So, my office hasn't been contacted directly by anybody from the governor's office, although we do get emails from the Association of Counties and from some of the governor's offices. But there has been no close coordination yet. And I look forward to being able to share with the residents of Mono County those criteria, bearing in mind that sharing those criteria is not the same as starting right away. We'll know when those criteria are released, when the events are going to happen, what events will happen in the future for us. But just that announcement doesn't mean we're going to be changing our behavior immediately. Thank you.
Thank you, Bob. Justin, next question.
I'm gonna jump in, Brian.
Sure.
So, in looking at reviewing the questions, and there's an emphasis on the economic recovery side, North County businesses. Jeff Simpson has joined us and can elaborate a little bit more on what he knows about what the locals have been requesting, what may have been received, and I think he has some good news.
Yeah, thanks, Supervisor Peters. Just an update on the two SBA programs. The first is the EDIL, the Economic Injury Disaster Loan, that can provide up to $10,000 for your business. That's been adjusted. They'll give you $1,000 of forgivable loan for every employee you have, up to $10,000. There is some requirements on that for having employees on January 31st, but you can submit a 2019 calendar payroll if you are a seasonal business in Bridgeport. The other program is the PPP, the Paycheck Protection Program. That is also employee-based. That can give you payroll expenses. You can take your total 2019 calendar payroll expenses and take the 1 month average of that, and you'll get 2.5 times your monthly average in forgivable loans. I've talked to several businesses throughout Bridgeport who have applied for these. I know of at least a few that have been approved for the PPP program. And so that money is coming. And I'd recommend working with your local bank to get that program started, or you're welcome to call my office. I'm happy to work with you through all the spreadsheets.
Thanks, Jeff. Next question. Is this surge of cases realistic, and when?
Yeah, I think I can address that. So what we are currently seeing is what appears to be what our goal was, which is flattening of the curve. We currently are at 23 cases. You know, up until Sunday, we were at 21 with a week period of no cases being diagnosed. So optimistically and cautiously, I say we seem to have flattened the curve here in Mono County. However, that being said, you know, we can't let up yet. We're not out of this. If we let our foot off the gas, the virus will definitely get a foothold again, and we'll see a rapid incline in cases.
Thanks, Brian. Many of us feel that we are constantly being lumped in with Mammoth. What are your thoughts on this matter, and how are we being sure that Northern County businesses are not being treated the same as Mammoth businesses when we operate in a much different environment?
Chief, are you able to speak to that?
I can speak to that. In my experience through this this pandemic, this emergency, that there has been a lot of emphasis through our, and Jeff might add to it, through the economic recovery branch, to recognize the differences between the seasonal businesses that that are in North County. And so far, a lot of the funding models that have been presented out of the federal government, they're not looking, they don't fit exactly what a North County typical 6 to 8 month business might look like. So I think as things evolve, there will be more that will be addressed closer. I've been working with the California State Association of Counties, and I know my colleague, State Chair Stacy Corliss, has been working with Rural County Representatives of California, RCRC, and this is front and center on the agendas and the priorities right now, is addressing rural California, their seasonal nature of business, and it may seemingly appear that we're all lumped together as a homogeneous group of businesses in Mono County, but they are being differentiated and they are being addressed, and we're trying to come up with solutions to help the businesses that just don't fit the exact mold that the federal resources have provided to date.
Thank you,
Thank you,
Supervisor Peters. I know that, sorry, Brian, Chief Freevault has asked to chime in as well.
So on one side of this, your elected officials, as Supervisor Peters mentioned, they're pushing up the case for rural counties, and it's not just Mono County. There's other counties up and down the state that run on a same seasonal economic model. So, you know, you're not alone. There are other elected officials banding together, getting this message out to the state. We have seen some unprecedented adjustments, even by the federal government. We've been receiving some in-progress reimbursements. I've been in this business over 40 years. I've never seen that. I've heard of it, but I've never seen it. And so there are adjustments being made as elected officials kind of state their case and define it a little bit. I want you to know that on the other end, this recovery side, I was in a discussion today with Hospital Administrator Tom Parker. He and I are heading up this collaboration between the clinical kind of hospital public health and economic recovery side, how we get those aligned. And I asked very specifically today, as one of our standing to-do items, is to see if there's a way to recognize the rural nature, even more rural nature of Mono County, both north and south, some places that are, you know, much like Bridgeport, Walker, to see if there's a way that we can intentionally recognize that being more spread out than places, you know, like Mammoth or like Bishop, not just from the economic side, but also from the epidemiologic side. I'm not saying that we can, but I'm saying that we're absolutely asking that question so that it's being looked at intentionally to see if we can make those adjustments.
Thank you, Chief. Justin, next question.
Thanks, Brian. I've got two that I'm going to lump together, and I believe you'll be able to address. The first, you mentioned the guidelines have loosened for testing. What are the current criteria? The second, when will Mono County be doing antibody testing?
All right. So we've basically expanded capacity so that anyone with symptoms can be tested at this time. And anyone that is referred from the health department from contact tracing or the nurse triage line can also be tested if a nurse deems that appropriate. And Justin, what was the second part of the question?
Related to antibody testing.
Oh, that's right. I know that's been a hot topic. Antibody testing isn't really ready for prime time yet, to be honest with you. There are only 2 FDA-approved antibody tests at this time, I believe, and that is the Abbott and the what is the one that was just passed last week? Oh, Stanford. Sorry, I couldn't think of that. The Stanford test as well. Those are the only 2 that I know of that are FDA approved. There are a lot of tests that have come on the market that aren't FDA approved, and we question the validity of the test. They haven't been proven, they haven't been properly vetted, and you could potentially take one of those tests that I see are advertised at a lot of places now, and you could get an answer that you have had corona, but it could be a false positive. And in that case, that person would have a false sense of security in regards to immunity, and then could potentially, contract the virus, spread the virus to others, become very sick, all of the above. So where antibody testing will be important in the future, it's just not ready yet. And hopefully within the next several months, we're going to see more FDA-approved tests be available.
Thanks, Brian. When Governor Newsom begins to lift the stay-at-home order, will Mono County follow, or will Mono stick to the later date? And if sticking to a later date, has anyone thought about the possibility of allowing longer-term stays, catering to the guests that plan to stay 7 days or more to cut down on transient occupancy?
Chief, are you available for that one? Oh, maybe we lost Chief.
I think we lost him.
All right. Let's see. Can you repeat the question for me, Justin? I'll try my best to answer it.
So the first part I believe was discussed. When Governor Newsom begins to lift the stay-at-home, will Mono follow? Let's start there.
Sure. So as we look to move back to normalcy, yeah, we will very much be looking to the governing body of the state for these decisions. That being said, we will look specifically at mono-specific issues. So yes, we could potentially be a little stricter than the governor, but again, that'll depend on a lot of factors. As far as one of our concerns is, we pretty well contained the virus so far in Mono County. When we open back up, our concerns are not so much our own community, but people from the LA Basin coming up or other locations, and then potentially spreading the virus to us. So we have to look at other areas of California to see how their numbers are as far as infection when we consider how we're going to open, because that has a direct impact on us.
And then the second part of that was, should Mono stick to a later date, has anyone thought about extending the allowance of long-term stays 7 days or longer to generate some activity in the county?
I don't believe that's been discussed at this point as far as lodging. That is a much broader topic, and as I said, a lot of that will depend on how the virus is in other areas, because that's, the tourist base is our biggest concern when we open back up.
Thanks. Next question. We've talked a little bit about this, but this is a little more specific. Can you tell us what town the virus is in? This would make people take this more to heart and do better to protect everyone in the community.
Another question for me. So that is why I did a little bit on HIPAA at the beginning of the meeting here. We cannot. We are in a very small community, especially outside of Mammoth, Crowley area. And it's easy to identify people with just traces of information. So if we said it was a 50-year-old from Benton, for example, and was hospitalized, or or a 50-year-old from Benton tested positive, and someone in Benton goes, my friend down the road had a cough the other day and went to the hospital. I think it's him. That would potentially violate HIPAA, which is a federal law. So, and we want to protect everyone's personal information and, allow them to remain anonymous as far as diagnosis of disease.
Thanks, Brian. Is the county doing anything to better help if in the future there are surges in the area of COVID-19, such as accessibility to additional hospital beds and ventilators?
So the hospital has greatly increased its capacity for the surge. They've totally rearranged the hospital. There are clean areas, what are considered clean, or areas where there's no virus, and then dirty areas where there is potentially exposure to virus. They've ramped up their capability massively, and as far as ventilators, I believe they are now up to 6 ventilators as of today. That is pretty good capacity for a small hospital. We are better off than most facilities.
I saw that the county is finally requiring essential business employees to wear a mask. When will that be a requirement for the general public? Shouldn't everyone be wearing one?
Ideally, yes, everyone, we would strongly recommend that when people go out into public, that they wear some kind of face cover. And it doesn't have to be a mask. It can be a scarf. It can be, one of the face shields you wear for skiing. The idea behind the face shields is so that if you are positive for corona and don't have symptoms, you can still, the 25% of the population that gets COVID do not have symptoms and do not know that they're spreading the virus. So by wearing a mask, it cuts down on the amount of virus that would be shed by that person. So when you're wearing a face cover, you're not so much protecting yourself, although it will to a certain extent. You're protecting your fellow citizen.
And then part of this question, Brian, you may have answered it while I was reading. This information about testing and positives is shared, for instance, with databases for the state and others, correct?
Yes.
And this question specifically asks, is there an issue in not sharing this information with school administrators?
School administrators wanting to know.
Yeah, not giving names, but giving the number of infected individuals in a specific region. I think it's addressing, again, getting more specific into a region.
Yeah, I'm not sure why we would share that information with school administrators. It just doesn't seem logical to me. Is that person still available to clarify the question? Or is this a write-in?
Ask.
Yeah, I'm going to jump in here. So I've had lots of inquiries from first responders, fire chiefs, and maybe Chris McCrassick, he's still on the line, can answer this, but who are we sharing the information with so that in the course of their profession that they can be prepared to address their, the population they're kind of tasked with overseeing, like a school administrator, volunteer fire department. That's the kind of sort of granular level of information that would seem that would be considered so that people can be prepared. And I've heard, I know from the hospital administrator and the health officer, what everyone has to remember in all of your daily lives as you interact with others is assume that the person you are potentially having a conversation with, running into at the post office or the store, is carrying the virus. And so that's sort of the basis right now. And but Brian, can you elaborate more specifically on HIPAA and the population criteria for releasing more granular information? Like, why can Carson City give all the information about age and sex and all that, and we can't? Because there are legal reasons behind that.
Right, and good point, Supervisor. And it's a bit of a numbers game. If Carson is reporting a male in his 40s from Reno tested positive, well, how many males in their 40s are there in Reno? A fairly large amount. So many that it would be really kind of hard to figure out and deduce who it is. And that is exactly why we don't give out that information. We're talking about towns with small numbers, so it's easy to identify people. And that's really why we're limiting information. We are just safeguarding individuals' right to privacy. And, it is a federal law with very large fines associated with it. And, we just want to protect everyone's rights.
Thanks, Brian. So at this time, the questions have been cleared.
Okay. Well, then let me, because I've been sort of following along on the questions and some of the statements that have been presented. And I know that there's, some angst over what the answer, are the answers just rhetoric, or are they really addressing the true nature of the questions? And there's some struggling with the North County businesses and the seasonal business question really being answered directly or just politically. So to the best of my ability and with the knowledge that I have through our economic branch and through the EOC, which does sound political, but it is a state of emergency in Mono County, where there are parameters and rules for public officials, for county employees, for other members of the EOC, which is the Emergency Operations Center, through the Unified Command. And the Unified Command is a representative from the town, a leader from the town, Dan Holler, Bob Lawton, our leader of the county, Frank Freefalt is the spokesman for the Unified Command, and Tom Boo is our health officer. He has the authority in this medical health emergency to enact regulations and orders that relate to the emergency for the public health and safety. So I will, we're running up against an hour, but I would like to be able to come back with a meeting. I tried to organize a meeting without the EOC, and I was told right away, you can't do that. You can't just have a town hall and like the town halls that I've organized in the past. But I want to give Jeff Simpson one more shot at addressing the economic recovery and the businesses in North County. I know we're in the process of developing data, and that there's going to be an effort moving forward to get like businesses like restaurants together, motels together, retail together, other businesses that can share what their challenges and opportunities and accomplishments have been so far during this course. But Jeff, why don't you take one more shot at it?
Yeah, thank you, Supervisor Peters. And I'm sorry just to talk about the SBA program, but that is time sensitive and it is first come, first serve. And that's why we're pushing so hard with those programs to try and get our businesses signed up to get that free money, to get that money from the feds into our business owners. I think we know that every community is unique and every business community is unique. And within Bridgeport, the businesses among Bridgeport businesses are unique as well. And so I think what we need to know is what makes you unique and what do you need from us? Is it cash flow? Is it operational costs? We need to hear from you on what your business needs are and what makes your business unique. We've sent out a survey yesterday. If you haven't received that, please reach out to me. I'd be happy to forward it over to you, or just contact us directly. We'd love to hear from you. What are your issues and how can we help? We don't have answers for everything, but we're putting together this economic recovery plan. We have a lot of draft guidelines and plans moving forward, but we need to hear from the business community on what are your issues and how we might be able to address that moving forward.
Thanks, Jeff. And Brian, I do have clarification from the one individual on the school administration question. We are providing food to folks in the community, and it seems appropriate we are even better supplied with safety equipment if we are going to continue this practice.
So again, I would refer back to what Supervisor Peters said, and that was, it's universal precaution. And, as a nurse, I've practiced this for years. And again, it's just, you assume everyone has every disease and you take care of yourself appropriately. I understand, the concern that you're meeting with the public potentially for these, for handing out foods to students. I would recommend, if you're not already doing it, that you do it in a way where there's really minimal contact, where you put the food item on a table, you step 6 feet back, and then you let the client come up and pick up the food item. Things like that. That's how we move forward, not by identifying people.
Okay, so we're up against the hour allotted for this meeting. There's a lot of participants that have worked hard to be available and to have the answers to hopefully most of the questions. I know that it's a difficult time for everybody, and just we have to remember that we're all in a new environment of COVID-19, and the goal is to keep everybody safe, to have nobody that's preventable from getting sick, get sick. And we're doing a really good job. And it's sometimes, when you're doing a really good job at something, it seems like it's over. The job's done. We're done. But there's no one, and I've been told this in many, many meetings, nobody who's trying to prolong this beyond a health and safety prevention of someone getting sick purpose. It's all about how do we take care of our people, the people in Mono County, the best that we can with the resources we have. And it's understood, and I've brought it up several times, that our the medical community for Mono County, for people that get sick in Mono County, is far reaching. There would not be anybody except in an emergency situation put on a ventilator and have sustained care in a hospital in Mammoth. And we rely on Renown, we rely on other places, but we had to prepare ourselves that if we couldn't send somebody out, that we could take care of our base population. So now we're trying to figure out how to come back to an economically viable population, which is tourism, and the tourists combined with our base population, and everybody's working really hard 7 days a week to try to figure out what that equation is. And there is twice daily meetings with the EOC. They are tirelessly trying very hard to figure out where that balance point is, where that curve is flattened. And as more testing and technology and medical advances occur, we're going to get closer. And it's not as far away as far as we have come, I believe. I think we're not talking about months. We're talking about, a finite amount of time that every day we know more about. And in terms of the economic climate and how do we recover with the resources that are available, That's been evolving, and it's frustrating to the businesses that are trying to navigate that system. And our capacity is still the same capacity we had with our internal resources before this this pandemic, which is a department of 3, where one of them's out right now. And so basically Jeff and Alicia have done a very good job of trying to keep up, trying to provide current information and resources, and just don't give up. Stop, don't give up on utilizing our resources, staying home, staying safe, staying away from others, and this will be over, and we will get back to normal and we'll thrive. And the reason why we all came here was because we love Mono County. We love the place itself, the people that are here, the people we get to invite to come, and that will be happening soon. So I appreciate you all participating in this. It was very productive, and I think, you know, we'll look forward to trying to organize another one of these locally in Bridgeport if we can. And thanks to all the EOC participants, our PIO, Justin, and I think we'll close the meeting out now. And if you guys haven't met Bob Lawton, who spoke a little bit tonight, he's probably, I don't know if you've been here a month, Bob, or a month and a half, but he's brand new and he's dove in 100%, and he's our county administrator. So if you happen to see him, stay at least 6 feet away from him, but welcome him to Mono County. Thank you all.
Thank you, Supervisor.